Hi, Artie Lane here, and I want to talk about Ayurveda and how to do some emergency pain and inflammation and bruising treatment. Okay, so here I go. I have a couple of examples. So we can use really actually any oil you already have at home. So if you have olive oil or sesame oil is great, coconut oil. Canola oil is not a good oil to eat or to use for anything, so throw that out. This is really great. This is like a massage oil. I'm realizing you see everything like the mirror wrong. It's blended, so it's sesame oil. So you can use any sesame oil, but if you want to have something blended with ashwagandha, bala, there's some herbs in here. You can readily online order that, but it's not necessary, but it does help. You can also, here I have sweet almond oil. That's really amazing stuff too. So I put my oil in a little pot here and put it on the stove to warm it up to, warmer than room temperature, nice and warm. And let's say I bruised my elbow, like I banged it, but maybe it was hurting already. Let's say I don't know, maybe I have inflammation, maybe I have arthritis, maybe if I'm overusing. Let's say I didn't go to the doctor. It hurts. I don't have a diagnosis. Let's just keep that out. It hurts. And this is what really, really helps. It takes the pain out. If it is inflammation, it will be taken out. It's anti-inflammatory, anti-heat, antiseptic. If it's just a bruise and you can, it's visible. And when I was a kid, I didn't want to, massage my bruises. I didn't learn that until I was in India, and you get bruised and people massage it in. You want to break it up. You want to get circulation in it. And the breaking up and circulating and anti-inflammatory is something you do with these oils. So you want to have it nice and warm. Make sure it's not splattering your favorite clothes. So just really know that oil does stain. Let's say it's my elbow what's hurting, but it may be your hip, it may be your knee. But this is so easy for me to show you. What you want to do is like application of the oil externally, and you at least for 20 seconds, you want to apply some nice gentle pressure, and you want to do circles on joints. See if it's like your hip or your knee or your elbow, yes. And if you can count 20 seconds, you can also do this a lot longer, and you want to leave this oil on. Nice is also, you can just leave it on, let it stay there. If you have it, let's say at the hip or somewhere where it's not convenient to be oily for the rest of the day or the night, you could cover it with something, not your favorite old sweatpants, old sweater, sweatshirt, something not your favorite because it's not so washable. Or you could leave it on for half an hour, 30 to 60 minutes, just really leave it on. Then go take a warm shower, pores open, oil seeps even more into the body, and you will have something what rebuilds cells. So it's a tissue builder. So it does so much more than we can understand. And with experimenting and experiencing, I've been doing this for some time, it really works. So, it lessens the swelling, it lessens the bruising, it lessens the pain, the inflammation, or arthritis, etc. It's so good for so many things. So really, I want you to experiment with it and then experience it and give it some time. After once, it's not like excruciating pain. It's not immediately better, but honestly, it's already a little, it takes the edge off. And just really be loving and self-caring, and that's part of it too, like our own hand. It's nice if somebody else does it too, but that loving kindness to the body, like it's very healing. It's really powerful, and we all have that available. So yeah, so treat yourself with loving kindness, and if something hurts, please just take care of it and address it and pay attention. So yeah, pain is trying to communicate, and if we're not listening, it's going to get louder. So that was that Ayurveda oiling for if you banged against something, if you hurt yourself that way, or if it's some lingering, ongoing, underlying chronic stuff. Either way, give this a try, and thanks for watching.